This is the first ever strategic plan that Royal Cornwall Hospital Trust has ever had, and it's clearly time to review the fortunes of the Trust. This is a dynamic strategy. It's a long-term strategy, but it's one that will be vigorously reviewed every year in detail. We have to be held accountable for every part of it. The whole board has got to give clear leadership to every part of the organisation. We have to be held accountable by our own staff. We certainly have got to be held accountable by our patients and their families and the wider public, the wider stakeholder group. We cannot deliver it ourselves. We are part of a wider both health community and the community of Cornwall. We have to be outward facing. Possibly for too long we have been inward facing. We have to clearly discuss and understand what our stakeholders' strategies are. We need to explain very clearly to them what we believe ours should be and jointly agree how we are going to work together.
The second major theme is that of integration, of looking to make sure wherever possible that the acute and specialist services, which are our particular part of the NHS, are delivered in as joined up and integrated way as possible with the services that people receive in primary care, from community health services and from social care. The population that we serve, both with its dispersed rural nature, but also with a higher than average number of elderly people and therefore a higher than average burden of long-term conditions of chronic health. The things that we do have got to be linked up with primary care and with social care and community services, because it's only if you can get the whole system to work together that you really be able to promote independence amongst people with long-term health conditions and, wherever possible, ensure that their care is delivered outside hospital.
The acute hospital is only a small part of the health and social care system, and in Cornwall we need to increase our talks with social care, with the Mental Health Trust, to work more and more together on care pathways so there's no delays in the system for our patients.
Clinical teams across the organisation are really excited about the clinical strategy. They help build it. I just get the impression, talking in my day-to-day work as a clinician, that there's a huge amount of support and drive coming from clinical teams.
In conclusion, it is abundantly clear to us all, I think, that we face potentially a very exciting and challenging future. We want to achieve what we all agree and what we all most want, which is to work for a very successful organisation. I want us to build together our organisation to provide the outstanding care that all our patients, their families and our staff deserve.